Karen, thank you for being here. So my first question is, how far have we come with HIV?
We have come so very far. When HIV was first recognized as a medical illness back in the late 80s, early 90s, an HIV diagnosis was like a death sentence. It was a very terrifying disease. But with all of the amazing research and especially the development of medications, people now live for many, many years in very healthy, productive, normal lives with easy to take, tolerable, safe medications.
Well, so that leads me really to my next question. What does HIV in 2019 realistically look like? Because, you talked about just then, you said it was a death sentence. And I think one of the biggest obstacles we have in this country is that that's where the story ended for many, many people in the LGBTQI community, especially in the quote unquote straight world. It ended with those images of emaciated men, sometimes handcuffed to hospital beds. And sometimes
very heartbreaking.
Yeah, but that's the last image and the lasting image so many people have.
Right.
When they hear HIV, that's what they think.
Right.
What's the reality?
The reality is now that persons who are becoming infected, they're young. HIV diagnoses are more frequent among young men, ages 18 to 34. They're young, healthy, active, vibrant persons. They become diagnosed when they go to see their doctor. They're started immediately on medication that helps them to remain young, vibrant, healthy, and they're healthy for many, many, many years to come. And so it's not a death sentence, it's simply a chronic disease at this point. It's like diabetes or hypertension. You get the diagnosis, you take your medications, and you have a normal, healthy, happy life.
So let me ask you then, is there any reason in 2019 for somebody to look at me as an HIV positive, undetectable man and be afraid of me because of my HIV?
Absolutely not. As an undetectable HIV positive individual, persons do not transmit their infection to others, and they're very healthy, and they just take their pill as if it were antihypertensive or
multivitamin.
A multivitamin is a great, really amazing era that we're in right now.
So when I say, because I've copped flack for going, look, it's a chronic illness. So is diabetes.
Right.
And people go, oh, that is just so ridiculous. You're so off the mark. And I think it's largely because it's associated with sexual transmission or IV drug users.
Sure.
But am I off the mark by saying it's a chronic illness?
No, you're right on the mark. I think, unfortunately, we still have some stigma associated with HIV, both living with HIV and taking medications to prevent HIV. It's a disease that is easily and effectively managed with very safe medications that virtually every American has access to through some of the great systems we have in place, such as the Ryan White program that provides outstanding HIV care. And so it's simply a chronic disease. And I think our healthcare providers who take care of chronic illnesses like asthma, diabetes, hypertension, can just as easily provide care for HIV. And I don't think there's a term, HIV exceptionalism. I think we need to move away from that, because HIV is just another illness like so many others. And we would love to see the stigma associated with it fade away.
Sorry to cut you off. I hope that U equals U, undetectable equals untransmittable, is, as I've sort of described it, the key that releases the handcuffs that so many of us, when we're diagnosed, pre-U equals U, pre the CDC's announcement, along with Dr. Fauci's very clear statements, we can now take those handcuffs off and start to live our true lives.
Yes.
Can you talk to me about U equals U as a preventative tool? And what are some of the other preventative tools that I know you know quite a lot
Right.
about.
Well, there was a very important clinical trial several years ago that showed us, very definitively demonstrated to us, that if a person's viral load is suppressed and they are undetectable, that they do not transmit their infection. It's called treatment as prevention. We call it TASP, but it's a very, very effective prevention tool in HIV. And so I think treatment for HIV is really wonderful because it ensures good health for the individual who has been diagnosed with an infection, but it also protects the community because when a person is virally suppressed, they don't pass their infection along. And I think another really powerful prevention tool that we have is called PrEP, pre-exposure prophylaxis, and we call it PrEP. And PrEP is a really exciting prevention tool. It was approved by the FDA in 2012, and I think it ushered in a paradigm shift in HIV prevention. It's a single pill with HIV medicine. It's safe, it's well tolerated, and people who take it daily as recommended by their providers, they don't become HIV infected. In fact, it provides about 90%, more than 90% protection for persons who take it daily as directed. So it's a very, very exciting intervention.
Now, Doctor, I know about PrEP, and again, I think anyone in the sphere of HIV, whether they're HIV positive or they're directly related or associated or work with HIV positive people, know about PrEP. But I think a lot of people in that sphere hear PrEP, they think Truvada HIV drug. So first of all, very toxic side effects. This is one of the myths out there. Very toxic side effect. And just for homosexual men who want to have sex without condoms. How far off or on the mark am I with those statements?
Those statements are very off the mark. PrEP is for anybody who wants to protect themselves from becoming infected. PrEP is a very empowering intervention that allows an individual the control to stay uninfected. I think PrEP is indicated for heterosexual men and women. It's indicated for persons who inject drugs. It's a very effective HIV prevention intervention for that population.
Really?
Yes.
I had no clue. So
Yes.
It's not just on the sexual transmission side of things.
No, and it's so very safe. We have a great deal of data from a lot of studies that have been done that were published starting in 2010 and are still being published that have demonstrated that there are really no serious side effects from PrEP. It's incredibly safe, and very well tolerated. I think it's the product of a lot of research that has led to our current array of treatment medications. They're really easy to tolerate and they're very safe and effective. People have very minor side effects for the first few days when they start taking PrEP, but they go away very quickly. And as you've mentioned earlier, it's like taking a vitamin. You take a single pill once a day and you're safe from becoming infected with HIV.
And let's be honest, every medicine on the market has potential to have various side effects.
I think perhaps aspirin has more serious side effects than PrEP. When you take aspirin, you can bleed a lot. PrEP is very safe. It's very safe.
I want to go back to the point of, there's an expression out there called slut shaming. There are a lot of people in the healthcare profession, doctors, counselors, people out there in this medical field who have, they say, well, U equals U, PrEP. It's not really in my opinion that this is the right thing because of the potential lifestyle that this encourages. What do you say on that topic in particular?
Well, I think that's really unfortunate that an individual would go to his or her physician and be told that their lifestyle isn't acceptable. I think we strive towards framing people's sexuality in a very healthy way, and protecting oneself from becoming infected is a very healthy focus on one's sexuality. And so I think we're working, we nationally are working with our healthcare provider community to help educate them about PrEP.
What do you say then to the people who say, well, well, this doesn't affect me. I'm a happily married woman. I have 3 wonderful daughters and a fabulous husband. Why do I need to know about this?
Well, for I think of 2 reasons. I think you need to know about it because your husband might have a partner that you don't know about. He could potentially become infected and infect you in turn. And so if you live in a community where there's very high rates of HIV, you might want to consider protecting yourself by taking PrEP because it's something that a woman can control. It's very empowering for a woman to keep herself from becoming infected.
So then my next question is, it's all good and well saying you equals you undetectable equals, and all good and well going you should get on PrEP. Let's say I don't have insurance. Let's say I'm working 4 jobs. I'm a single parent and how do I, in the United States, I don't have access to this. So this is all good and well. You're a white guy of privilege and there's a lovely white doctor sitting on the couch and you're talking about this wonderful medicine. Well, that's good for you. You can get that. Right. I can't. So what good is this to me?
That's not true for either antiretroviral medications for treatment or for PrEP. I think, as I mentioned earlier, we have the Ryan White healthcare system in the United States, and we also have ADAP. Are you familiar with ADAP?
I'm personally very familiar with ADAP.
The AIDS Drug Assistance Program that will provide antiretroviral medications at no cost for persons who need them. And likewise for PrEP, we have drug medication assistance programs that are provided by the manufacturer of the medication, and persons are eligible if they're underinsured or uninsured, or even if they need co-payment assistance. And those programs are easily accessed. I think we would like to have healthcare providers know more about that, know more about, connecting to those benefits, connecting their patients to those benefits.
Yeah, because again, and this stems from the systematic failures of stigma that have existed for the last 30 odd years or more when HIV came onto the scene. Again, I don't want to deal with that because people are going to assume that I'm a man who may have sex with man, or someone might think my husband is cheating on me. I mean, we have a lot of barriers still to conquer.
Yes.
How do we get through this?
Well, I think we could start by having our physicians and other healthcare providers talk to all of their patients about PrEP and make them aware of it. I think on the basis that even if perhaps a given individual might not need PrEP, they might have a sister, a brother, a son, a grandson, a cousin who they can tell about PrEP. And I think by normalizing PrEP and making communities aware of it, and being broadly aware of and part of community knowledge will really help to decrease the stigma, and I think will help people who might need PrEP find their way to PrEP.
Help me understand. So because I've heard this analogy. Well, PrEP is no different than what the pill was when the pill came on the market for women. Mm-hmm. Have you heard that analogy before?
I have.
And what do you make of that comparison?
Well, I'm an OBGYN, and so I like that comparison. I think it took us many years to move beyond stigma associated with taking oral contraceptives. I think it was very stigmatizing for women, especially women who might not be married. And I think PrEP is quite analogous. I think it's equally safe and effective and really a very powerful tool to protect persons at times when they want to avoid an outcome. In the case of oral contraceptive pills, an unplanned pregnancy, and in the case of PrEP, a life-threatening illness, which is HIV.
How do we change people's minds about this?
I think we're working to do that. I think this interview helps to do that. I think I talk to everybody I know about PrEP, and they now know all about PrEP. They think it's a normal, healthy thing for people to do. I talk to, the hairdressers in my hair salon. I'm kind of their consultant for PrEP. I talk to people who I meet at parties. And did you know you can take a pill that prevents HIV? And I think we can all do that. But I think healthcare providers especially can do that. We have a lot of studies that have taught us that people really trust what they hear from healthcare providers. And so if healthcare providers start to promote PrEP, understand it, and destigmatize it, that'd be a really good start.
And again, I just want to reiterate, PrEP is not just for homosexual men
No.
who want to have condomless sex, is it?
No. PrEP is for gay and bisexual men. It's for heterosexual men and women. It's for people who want to become pregnant and they want to protect the other partner from becoming infected with HIV when, of course, they have condomless sex to conceive. So it's a very powerful tool for a lot of us.
Thank you so much, Doctor. That's great.
Yeah.